Welcome, ladies and gentlemen. Thank you for joining us this evening for the next webinar in our series around courses, and our specific focus today on course delivery and the activities required. But this is an opportunity for you to ask any questions you would like of the team, and also learn about anything around any of the programs we offer, and maybe those burning questions you have deep down inside. If you would like to ask a question of us, and we're going to do a short presentation, then do a Q&A afterwards with the team. Down the very bottom of the screen is a Q&A panel, little Q&A thing with a couple of little thought bubbles. If you'd like to click on those thought bubbles and then put some thoughts into those bubbles, that would be awesome, and then we'll be able to ask those questions at the end of it. So I'm just conscious of everyone's time, and I do once again appreciate everyone's time today. And as I mentioned before, the focus on the presentation specifically is going to be focused on the course delivery and the activities required. And we're very pleased, I'm very pleased to introduce you to Richard Silsby, who would be very familiar to many of you. Been in the industry for a very long time, been working with us for a number of years now. Richard, is it 5, 6?
Yes, 6, 4, thank you.
Yeah, excellent, exactly. Gets probably less for murder. But look, we really appreciate your time today, Richard, and I'll throw over to you, please.
Well, thank you very much, Paul, for the introduction, and welcome everybody to our HealthCert education event this evening. Certainly the goal, as Paul mentioned, is really we want to peel back the skin on some of our courses so that you know what's involved, how you can get your professional development. So I'm just going to share my screen with a few slides that we have so that you can follow along, and we just go through a few slides just to show you how the professional development at HealthCert works, how it can really help you develop valuable knowledge and skills that are going to meet the needs of your patients, potentially expand the services that you provide, and importantly, meet your CPD requirements. As Paul mentioned, we certainly welcome your questions. This is an opportunity. If you've got a burning question, you want to share it with us and have us assist. We've got an education team that will be able to answer your questions, really help you along your pathway. So as Paul said, we've got a team of education advisors. My name's Richard. It's certainly been privileged to work with HealthCert for 6 years. And really the goal of our education advisors is that we're here to help. We want to help you successfully chart your pathways. We find that everybody has slightly different circumstances, goals, interests and preferences to their learning. And so we try to bring that all together. Your discussion with the education advisor team can really help you in that regard. So what are some of the ways that we can help you? Well, there's many different ones, because the pathway to medicine is different for each person. So we want to help you chart that as an individual pathway, that where can we go from here, and to find out about your needs and goals and seek to really help you in that regard. When you think about the different learning aspects that we have at HealthCert, these are a variety of the topics that we teach. We're excited to continue to add new topics to our pathways, particularly the areas of medicinal cannabis and women's health are new areas. So we really look forward to sharing some of the details about those programs with you soon. When you think about the different formats that we use for the delivery of our programs, there are essentially two. We have the face-to-face delivery, that classroom environment. Really gives you an opportunity to develop practical hands-on skills, to be guided by a lecturer and to have one-on-one interaction so that you can really embed practical skills in that environment. And as a wonderful benefit, you're there with your colleagues, so you can use that as a networking arrangement to really not only take in the skills, but widen your network. We look forward to you joining us if you'd like to benefit from those programs with our next event coming up in Sydney in September. The other format that we have with regard to our learning is online learning. The learning in this way is delivered by video. It's really aimed to be flexible so that you can study when it's convenient to you and still be able to take in valuable learning, knowledge and skills that you can apply to benefit your patients. And the nice thing in the way that we've structured this is that it's not a specific time, so that you can get valuable skills, that university certificate, and be able to benefit from those, even from the comfort of your own home. So where did it all start from, or how do you get started in these programs? Well, the key is that, well, particularly for our online learning, as soon as you enroll in our programs, that confirmation email will come to you and you can begin straight away. You'll gain access to our e-learning platform and be able to, if it's convenient, start instantly working through those learning materials by means of our e-learning platform. In a similar way for that online platform is important for you because it'll really prepare you with pre-course activity and pre-reading so that you're prepared when you come along to the event and can really benefit to the full from there. So with our programs, our starting point is our professional certificate. Now, that may help you as you're looking to choose which is the right course for you, and certainly our education advisors will help you to choose that as well. But that's the starting point for most because it assumes no prior learning in the particular areas. Surgery, skin cancer surgery is an exception there because we do require some previous knowledge and skills to apply. But we're happy to discuss your prior learning, the experience that you have as you come in, so that we can really, as we've said, tailor a program that's really going to meet your needs and help you to reach your learning goals that you're headed towards. So how do we structure our programs so that you can really get the most benefit from them? Because I guess the key question that we often get asked is, well, what time is involved in these programs? How long will it take me so that I can get these skills and start applying them in my practice? Well, as you see with our online courses, we deliver it in a format where there's 8 modules. Each of those modules are delivered as a video lecture, and that's perhaps 1 to 1.5 hours. Now you can stop it and start it at your lecture, at your leisure, work through at your own pace. You can even watch them once, or you can watch them as many times as you like so that you can reinforce the learning. We then, with that idea of reinforcing the learning, have case discussions that help you apply the learning to real patient cases. We've got live webinars from the lecturer as well that will help to answer your questions and move you along your learning pathway. Then when it comes to our face-to-face delivery, obviously the key learning is coming along to that 1 or 2 day practical workshop. All of your pre and post activities will be done online. So that's a convenient way for you to benefit from those and to progress your learning along. Now, I imagine that by the time you've got to this point, you've probably had your fair share of exams, and so the thought of more exams is perhaps something that you don't want to consider. But this is just a way of reinforcing your learning, really, so that you can stamp the understanding and show how you're applying it. And this is really the final step towards you getting your certificate and also your CPD points. So these exams and assessments, activities that you complete online, our exams are not timed, and you don't have to complete them in one sitting. So they can be flexible, just like the learning, so that you can work through them at your own pace and be able to fit them in around your busy working schedule. Now, we do set a high pass mark of 80%, but if you're not able to achieve that, you can reattempt the quiz so that you can successfully pass the exams and get your award and then have the certificate for your wall. So that's very important. And with regard to the 2 different styles or formats in the way that we deliver our education, we normally have a closing date on our exams, 3 months after you attend a face-to-face program, or 6 months from the start of a new online program. But if you're not able to finish due to life getting in the way, well then we're very happy and flexible in providing exam extensions for you so that you can continue those and achieve your award. So what are the key requirements that you have for each program? So for each course, we have a pre and post reflective activity. We have 2 multiple choice exams that you complete. With our online programs, we also have case discussions that, again, as we said earlier, that aim to reinforce or apply the learning to real patient scenarios. So they're the requirements that you need to complete so that you can achieve your certificates. And that applies for both the professional certificate and the advanced certificate. When you go to the third part of our pathways, and that's to achieve a professional diploma, we do have 2 additional requirements, a literature review and a clinical audit. Now, it's only at this point that you have to present to cases from your own practice. And that's what the clinical audit is asking you to do, really to show how you've applied the learning from the courses to your own patients and benefited your patients in that way. Images are such an important aspect in many of the programs, so it's encouraged that you take images and include those as part of your clinical audit and can really supply that so that the lecturer really can see how you've demonstrated the application of that learning in that regard. Obviously, accreditation is very important, and with all of our programs, we seek to have them accredited by the primary bodies, the RACGP and ACRM, so that they're going to be part of your professional development and can be applied to your CPD program. So that's very important. We primarily seek that as part of our recognition or accreditation of our programs. There are many benefits for international medical graduates because our programs have reciprocal arrangements with other colleges around the world. And when you complete your activities to achieve a certificate, then we take care of uploading your CPD points for you so that they're uploaded to the college and in your account, ready for each triennium so that you complete your requirements there. And a nice thing about the programs is that many of them, because of that accreditation, are covered by bursaries, scholarships, even procedural training grants. So that can assist you in being able to enroll in those programs and subsidise your learning. The all-important award. So that when you complete your activities, this is the wonderful certificate that you can place in pride of place on your wall. Certainly your patients like to see that you've gone to the effort of really trying to continue to develop your skills and ability, and this shows the professional development that you've been able to achieve. So we deliver you an electronic certificate, and in Australia and New Zealand, you'll also receive a printed certificate so that you can put it in pride of place on your wall, demonstrating that professional development. And with our courses, we don't see that it ends just when you attend the program or when you complete the activities. We see that that's an ongoing process to support you in your learning. So from our e-learning platform, you gain permanent access to all of the resources that are there so that you can always come back and benefit from those. We have ongoing learning via our blog. We also are happy to receive your questions to pass on to the lecturer so that you can continue to have that support in your learning. And many love coming back for our alumni webinars just to refresh and be updated on the latest aspects of their learning. So once you become an alumni, you'll certainly be able to benefit from many of those benefits that we provide for those that study with HealthCert. So perhaps enough from me. We've run through some of the nuts and bolts of our courses. Hopefully you find it an easy learning pathway, but all of the education advisors at HealthCert are really here to help. There's various ways that you can connect with us. We certainly welcome even booking a 15-minute appointment where we can discuss your requirements and help you along the pathway leading towards the learning goals that you have. So without further ado, I'll invite Paul to come back. I think he has some questions, and so we certainly welcome your questions and be able to answer those for you.
Awesome. Thank you very much, Richard. I appreciate your time. So once again, just a quick reminder, down the bottom of the page is a little Q&A box if you'd like to click on that and put any questions in. Very happy to ask them. Richard, I'll get you just to unshare your screen so we can see everybody. And I'm very thankfully joined by some of our other education advisors as well, who may be familiar with you, because you could be the people obviously looking after you as somebody who's very important to us. And I think that the key thing, as Richard sort of highlighted, is everyone's journey is different, and obviously everyone has different experiences, knowledge, maybe other education they've done. So we're just very conscious of the fact it's not just really the, I suppose, a cookie cutter approach as far as what education is. It's all about tailoring it to your needs. So I do have a series of questions, if I could please ask the group, and I'll actually just start with you first, Richard, if I can, and then I'll sort of go around the room if that's okay. And I'll get everyone to introduce themselves and we'll go around the room if that's all right, because obviously hopefully everyone knows I'm Paul. So Richard, so how long between finishing the assessment and then getting my certificate, sort of normally?
Well, that's an excellent question. So as we said, there are 4 requirements generally. That's a pre and post reflective activity, and the 2 multiple choice exams. So I guess we often find that we perhaps, when we're in the excitement of passing the exams, we might not get to the post-course reflective activity. So we need to just make sure that that's done. But generally within 24 hours of completing the activities, we can send through an electronic certificate so that they have that straight away. And then we aim to, within a month, have their printed certificate if they're within Australia and New Zealand. Hopefully Australia Post helps us to meet that learning goal.
Yeah, and I obviously appreciate right now it's been a little bit challenging with relation to shipping and deliveries. I know that where I am, it's taking a little bit longer than it should. But no, thank you very much for that. Loretta, sorry Loretta, how are you? I'd like to, so the question for you, so how long do I get access to the course material after the course completion? So,
hi everyone, hi Paul. Yes, you receive indefinite access to your course material, which is a great advantage, so that down the track, if you want to refresh any of your learnings, you can just simply access your online and refresh any of the material that you've previously received.
Yeah, and I think that the important point of that is, like, particularly with certain courses, let's for example use skin cancer surgery. You know, when you come along and do the course, particularly the face-to-face one, you're going to be taught many procedures over the course of 2 days, and there's obviously a lot of information to absorb in a fairly short period of time, and it may be weeks or months before you get to do that A to T flap or whatever that particular procedure is. So the opportunity then to be able to go back and review the videos, because all the courses have, you know, step-by-step videos, etc., of these particular procedures, allows you then to refresh your knowledge with relation to it before you start doing the first one. So we are just conscious that for a lot of the education, there is going to be a lot to, you know, I suppose, consume in a fairly short period of time. Bear in mind, on online, you've got the ability to stagger that, whereas obviously with face-to-face, it's a little bit more drinking from a fire hose. But the key thing is that at the end of it, you do get content to it. And the other thing, probably just to reinforce also, is when you attend a face-to-face event, you get an online recording of that course. So it's not a case that you turn up and have to somehow visually memorize everything that you've just been seeing. There is a situation where you're able to review those videos later as well. So you're not sort of disadvantaged by doing face-to-face or online from the, I suppose, the access to the content perspective. I mean, with the face-to-face, as I said, particularly for the practical workshops, does have a little bit of additional assistance in that process. All right, moving around the room. Campbell. So hello, Campbell, how are you? What if I don't start the course straight away? So I've enrolled, but obviously life's got in the way. How does that work?
Yeah, excellent. Thanks, Paul, and hi, everyone. So one of the things that Richard pointed out was as soon as you enroll, so if you were to enroll in a course right now, you would receive the login email virtually straight away, and you can start accessing straight away in the current cohort. Now, if it turns out that you enroll and then life gets in the way and you can't pick that course up for weeks or months, no problem at all. Everything that has been made available is there. And as Loretta said, there's no time limit on that. So you do have ongoing access. So think about it this way. It's like buying a book or a important journal. Once you've purchased that, it's yours for life and you can work through that at your own pace.
Excellent. And obviously refer back to it later when you probably really need that little additional bit of information. So Owen, hi Owen, how are you? So the other courses recognised by the Royal New Zealand College of General Practitioners?
Yep, that's a very good question and certainly one we come across quite a bit. Simple answer is yes, there is definitely a reciprocal agreement there. Only slight difference being that if you are submitting to the Royal New Zealand College, it's just a self-submission, but we certainly can provide you with all of the details for that on your behalf.
Yeah, and I think as Richard obviously mentioned in the presentation, we do have established reciprocal arrangements with obviously different parts of the world, depending on where you are, but obviously very happy to help facilitate that to ensure you do get that recognition for local CPD or CME, depending on which part of the world you're in and what they choose to call it. Next question, I'll go back to you, Richard, if I can. So can I access the course offline?
Yeah, well, that is a good question. And I guess perhaps the simple answer is no. We do make our programs available, particularly for the videos. They need to be watched through our e-learning platform. The way that you could potentially access the learning materials offline would be, we do make available the slides that are presented by our lecturers. Many of our programs are delivered by subject experts from around the world, and so there is a transcript of their presentation. So I guess you could download that, potentially print it out so that you did have that offline. It's just the videos themselves that are only available online. Yeah,
and obviously nowadays with most devices, that's probably the best way to access them, and people can do so. Going to you, Loretta, I suppose this is another question that fits the same one, but do I need internet access to watch the videos?
Yes, you do. You just do need it for all that online learning and the video access.
Yeah, that's fine. I mean, as I said, I think people can appreciate it is primarily video content. As I said, there are some PDFs and some templates and other learning resources, which you can download obviously from that perspective. But yes, the videos are something. The next one, Campbell, if I can to you. So how does a bundle work? If I finish the first course early, can I have access to the second course as soon as I want, or do I have to wait for the next cohort?
Yep, great question, Paul. That's one that comes up a fair bit. So as Richard alluded to, typically a doctor would complete one of the courses, so the professional certificate of dermoscopy, say, in 3 to 4 months. And the same for the advanced certificate would take 3 to 4 months, and the professional diploma would take 3 to 4 months, and hence the 12 months. So when you go to register on the registration page or talking to one of us, typically you would enroll into each of those. So you might start in January and then May and then September. Now, I had a doctor last week who came to me and they'd enrolled exactly in that, but what they found with the current pandemic situation was that they'd been able to spend a lot more time studying and were already wanting to progress to the final part. So the short answer is yes, whilst you might be enrolled in specific cohorts, if you need access to the more advanced courses and you find within the e-learning website that you don't have that, you simply contact us and we just transfer you into the most appropriate cohort.
Awesome. So, I mean, so in theory, you could do the course as quickly as you're able to, obviously, absorb the knowledge, obviously pass the assessment as such. So there's no real timeline. I mean, as much as it's suggested to be 12 months, if you obviously have the available time, you are able to do it quicker. Yeah. And I suppose the only thing would be just, I think it's with the professional diploma, once you get to the very end of it, there's obviously a caseload, so a number of cases. So that tends to be a step limiting factor as far as completing that part of the assessment. Campbell, is that the case?
Yeah, that's exactly right. And I guess, like so much professional development and learning, it's important to start implementing some of the skills and knowledge as you go, because the way the courses are structured, you know, it's sequential learning. We are looking at more advanced cases, more complex cases as we're into the advanced certificate and the professional diploma. So it's important to have the opportunity to put these skills and knowledge into practice. So whilst you can progress as fast as you feel comfortable with, it is important to be implementing these learnings. And as Paul, you mentioned, with the professional diploma and the clinical audit, you are presenting cases that you've managed. So that's something to take into consideration.
Yeah, so that would obviously depend on the caseload, obviously, a doctor's got coming through their practice to be able to finish that last part of that assessment. So I suppose it's, once again, still good to do the learning. But I think the very good point that you make is, so the goal is to learn it, be able to put it in clinical practice, get comfortable with that knowledge, then start learning the next piece. And we do obviously have doctors who do want to do it quite quickly, and you know, maybe once again they've got experience or knowledge or caseloads that would match that. But obviously with sort of caution as well, to make sure to optimize your learning is be able to put it in practice, learn what it is, as I said, you are comfortable with and maybe what you're struggling with, so you can obviously ask those questions as you go further forward. I've got one more question left, which will put us pretty much on time, and I'm going to send it over to you, Owen, if I can. I did the professional certificate in dermoscopy 3 years ago, but I never did the exams. And I now want to do the advanced certificate in dermoscopy. Do I have to complete the exams for the first course? And then also, how do I go about doing that?
Yes, that's the one, isn't it? You know, enrolled in the course, life and everything gets in the way and can fall by the wayside. So obviously, as we've mentioned previously, you still retain access to those course materials indefinitely. In regards to would you have to complete the exams before going on to the advanced certificate, we would certainly recommend it. I mean, on that point as well, you've already paid for the program and done the hard work of working through the modules, so why not get your certificate and your CPD points anyway? In order to do that, if it was a while ago, it's likely we would just need to reopen your exams for you, which is very easy. All you need to do is just contact us and let us know, and we'll run you through the whole process. Once that's all done, more than happy to help you through the process to the advanced certificate as well.
Awesome. So yeah, so I mean, so in summary, you know, you are required obviously to pass one and move on to the other, unless there's RPL or something else that's gone through that. The other thing probably just to mention also with the content is that, you know, as we know that, you know, you might have done a course, let's say 3, 4, 5, 6 years ago, you know, medicine does change as far as what current guidelines or anything like that might be the case. And what we do is we do update the content regularly. I mean, typically every year at least, if not more so, depending on what might come up. So I'm just conscious of the fact that, you know, when you go back and look at, let's say, content now from a course maybe you've done a few years ago, you know, you might find that it has been updated. So, you know, that is obviously one of the fringe benefits of being able to go back, you know, through the program and having the lifetime value of the access is that as things do change, and look, and ultimately, like everything, that will be done for you. The other thing that we do is that as things do change and it is of significance in a particular area, we will notify you of that. Because as I said, unless you've got the time to read all the journals and keep up to date, sometimes that can be a bit of a challenge. Look, I want to thank everybody very much for your time today. It's a pleasure to spend time with you again. I want to thank the EA team. I want to particularly thank Richard for obviously organising the presentation today. And if there's any way we can help at all, and I think the key thing is we're here to help and support you on your learning journey. And as Richard mentioned, we've got new programs coming out. We've got women's health, medicinal cannabis, and also men's health coming out later this year. But we'll give you details as they are made available. But we look forward to being of assistance to you in any way, shape, or form that we can. So I'd like to thank you all very much. I hope you have a wonderful evening, and we'll look forward to speaking to you very soon.